So when people were treated in home isolation, was any prophylactic treatment offered for their contacts or their relatives?
Yes, there was a prophylaxis for household contact, and the regime was ivermectin 12 milligram on first day and ivermectin 12 milligram on seventh day. So this was the household contact prophylaxis. This prophylaxis is different from the healthcare worker prophylaxis which we got. You see, if you concede, if you just, I can share my the healthcare prophylaxis story. That to begin with, we doctors and nurses and healthcare workers, we have of course hydroxychloroquine prophylaxis earlier. But what happened when we did a survey in King George Medical University, 17% of healthcare workers developed some other kind of side effect with the hydroxychloroquine. 17%. Yes. So this was alarming. We stopped our administration that we will not take this drug. This is not a safe drug for us. And then after that GO, this GO says household contact prophylaxis, ivermectin on first day and seventh day, and healthcare prophylaxis on first day, 12 milligram of ivermectin first day, seventh day, 30th day, 30, and then once a month. And you won't believe, till date, Dr. Surya Kant is taking once a month ivermectin, is still after both doses of vaccination. My sick attendants, sweepers, everybody, nurses, all are taking ivermectin now once a monthly, because we have taken first day and seventh day, 30th day. So once a month, ivermectin is going on throughout the Uttar Pradesh.
That's impressive. Switching topic a little bit, there have now been a number of meta-analyses of treatment and prophylaxis with ivermectin. And my question to you is, do we still need more trials?
One very important trial is going on. At present, if you see, more than 40 clinical trials are going on globally for the, of course, mainly for the treatment, but a few for prophylaxis also. And 8 clinical trials are also going in India. One major trial is still on. That is the only question which is raised against ivermectin is the issue of dose. Because different part of the country, different part of the world is utilizing different kind of doses. Some they are using 200 microgram per kg body weight. Some they are advocating for 300 microgram per kg weight. Some they are using for 400 microgram kg per body weight. So in All India Institute of Medical Sciences at Delhi, one important trial is going on. Where they are using 6 doses. 6 milligram, 12 milligram, 18 milligram, 24 milligram, 32 milligram. So 6 kind of doses trial is 6 arm study is going on. I think we have to do such kind of trials so that we can settle the issue of doses. That is the only drawback which I accept, although I'm a strong propagator, a strong advocator of these ivermectin. But I feel that yes, the doctor community, the scientific community have to answer the issue of doses. The second, of course, question is still to be answered. Yes, the answer for the mass prophylaxis. Whether we should go for mass prophylaxis or not. Some countries have gone for mass prophylaxis, and in India, one state, that is the Goa, 3 days back, it issued the government order for the mass prophylaxis. So these are the 2 important issues which has to be settled by various clinical trials. So,
thanks. Those are very useful insights. Now, the WHO, the World Health Organization, has recently advised against the use of ivermectin, except in clinical trials. Do you have any comments?
As far as I am concerned, I am convinced, if I am convinced that this drug can save my life, this is my moral responsibility as an Indian citizen of this country, that I have to protect the lives of my people. So I will use ivermectin. What WHO says, I will never mind.
And finally, where should we go from here in India and in the rest of the world?
Yes, my dream is that now 7 states, out of 28 states, 7 states are with me, my thought process. And I wish Actually, right now, only 13 states are suffering badly in India out of 20 states. And out of 13, if 7 are following, so this is my victory, that this is the around 75-80% population suffering badly using ivermectin. So this is our victory. And I wish that it should be pan-India. I have also requested Indian Council of Medical Research, my health minister, Dr. Harshvardhan, who is a doctor too. So this is my request to the Ministry of Health, also Indian Council of Medical Research. So the time has come, then we should follow the Goa state, and we should give some kind of advisory, at least for these 13 badly affected states, so that we can have the, of course, mass profile, at least for the rural area, because now it is spreading badly in rural area. Urban, we have controlled very much, because in urban, we have a very good infrastructure of the health. We have developed the ICU facility, ventilator facility, good quality of hospitals, good quality of doctors, networking, everything is there. But in rural area, the health infrastructure is lacking, the poor health facilities are lacking, tertiary care of hospital, ICU hospitals are not there in rural area, and it's very difficult to, of course, take care of them. So this is my, of course, the advice. This is my request to WHOs, that please you can advise advisory for the developing countries at least. This is a cost-effective drug. This is a safe drug, and let us try this. And of course, in India, I think the day will come when we will use the pan-India. And of course, out of the more than 200 countries suffering from this, I think, of course, after vaccine, ivermectin can be a very important tool to save humanity, to save our people.